back to what you're looking for quality factors. Securing oversight, consumers, that can be a teacher looking for someone to train them in ABA. Most likely we think of it as families that are seeking services. It could be a one-to-one aide, somebody from another agency that we're training. But they often have poor understanding of what the necessary credentials are to be effective. And so the Behavior Analyst Certification Board is another website I'll give you. That's our regulatory board. And obviously, I have the Board of Psychology that I report to too, but all of us report to the Behavior Analyst Certification Board that's regulating us, that's looking at what is essential, what is essential in our field, and what is that code. Now, if you go on the website, you can look up the registry easily. You don't have to sign in or anything. So recently we got a referral call where I was glad they asked, but people don't usually ask this. The father said, how do we know that your staff are board certified? Okay, good. It's like look up the Department of Health Professions for us in general. Go to this website and put in the last name, and you'll see the staff come up, and it'll tell you, whoever it is. So if you're wanting to know if what they call ABA coaches in Fairfax County, some of them are certified, some of them are not. In Loudoun County, there are autism consulting teachers. It's that level that may or may not be board certified. I don't mean seeking certification, because sometimes providers will say, all of our staff are seeking certification. What does that mean? You want everybody fully certified. And then there's also an assistant level that needs to be supervised by a BCBA. This provides some safeguards, and I'm going to tell you, it is not the end-all be-all. I'm glad that we have a regulatory board now, because this is something in the last 10 years or so. But it is not the end-all and be-all, because remember, our field is diverse. You could find someone who's a BCBA, even in your area, and that person only works with corporations and job retention and corporate behavior, organizational stuff. So you have to also be sure that they have autism experience and training. So this is a minimal standard. We have people that come to us to do their experience hours that they need for certification. So we do their supervision. And that's one thing we've been really honing in on when they are done with their supervision is you have met a minimal standard. You're not like, great, I can do everything. You have met a minimal standard now. So you need to know what you can and can't do, so you're practicing ethically. The Autism Special Interest Group of the Association for Behavior Analysis also gives guidance. I'm going to pass this around to you. Link is on our website for this, and this is a better link, the one that I put on here. I recently changed it, but the Autism Special Interest Group and the Parent Professional Partnership Special Interest Group of the Association for Behavior Analysis have a combined website. It's a lot to say in one sentence. The PPP is a great reference. It's our parent organization. They have some special interest groups within them. Some are behavioral safety, organizational behavior. We're under autism. But there's one called Parent Professional Partnership, which helps parents understand terminology, tries to bring them into the conference experience and educate them on scientific procedures. On that website, you'll find these consumer guidelines. They came out in 2005. I was honored to be part of one of the review processes for this, where it was looking at what are some guidelines when you look at someone. Now we're just talking about only under ABA. Under ABA, who's qualified to oversee my home program or my school program? Here's an outline. It was in 2005, so it's probably going to be updated at some point soon, but pay special attention to the training and experience, not just the BCBA component, which is minimal. I'll pass this around, but this is just a quick summary. And, quote, true, it is a quick summary because there's a lot more to the document. Here are some of the guidelines. That BCBA certification. That's good. If you're a BCBA, you have to at least have a master's degree or higher, and you're looking for specific training and experience credentials in addition under Section 1 of that document. Section 2 is that you have 1 full calendar year of experience, hands-on training, and it gives like X number of clients with these kinds of methodologies, extensive errorless teaching, this and that, with 5 years of experience in the ABA programming. So you can see people that might work under our home programs and might hang out a shingle and say, I do ABA now. Okay, now do they need this? Because they're learning from us, and good. You're sharing the technology and you're moving on from that, but do they need this? And that's what we want the parents to know. And some of them get close to it, which is good. and some additional training, and that falls under things like the curricular resources. Do they have comprehensive curriculum knowledge? Do they know how to teach vocal and non-vocal behavior? So who's qualified? BCBAs know that there is an assistant level, it used to be called associate, now it's called assistant level, must be supervised by a B. So if you see BCABA, that means that's the assistant level. And there are other people qualified to intervene, obviously. Many of you, everybody here, right? We have speech pathologists that bring their technology into interface with ABA. That's also important. Our ethics code just got updated in June 2010, and I'll pass this around just so you maybe want to look at it. It's very similar. It was actually modeled on the APA one, more specific to behavior analysis, but since it's June 2010, I love it. They actually have some more stuff into electronic interface and confidentiality with, things like that. We were talking about Skype a minute ago and how that comes up. I'll pass that around. Okay, positive qualities of providers. I think this applies to all providers, not just behavior analysts, but